Key populations account for 39% of all new HIV infections in sub-Saharan Africa. The World Health Organization recommends prioritizing key populations in countries' HIV response strategy as a way to lower this number. While a number of countries program for key populations and conduct population size estimation, the success of these efforts rests on the ability to plan well and empower key populations. If these two ingredients are missing, the most vulnerable key populations will fall through the gaps and be left unaccounted for. Community-led outreach is a key strategy to ensure that peer educators and outreach workers link their peers to information, commodities, and services at the time and place where they need these most. Through community-led outreach, the outreach team builds trust among the key population peers and motivates them to join the program. To make community-led outreach more effective, a set of tools was developed to ensure that needs-based services and interventions reach these populations. Planning incrementally and at the smallest level, microplanning makes it possible to collect data in locations where key populations are available and use the data to tailor programs that address the needs of these communities. The microplanning process was initiated in India through the Avahan project supported by the Bill and Melinda Gates Foundation. Since then, the tools have been used by key population programs in Kenya, Zimbabwe, and Malawi. It is estimated that Kenya has more than 190,000 female sex workers, 60,000 men who have sex with men, 25,000 people who inject drugs, and 4,500 transgender people. The use of microplanning tools in Kenya has helped scale up contact coverage of key populations across counties. Microplanning tools have also empowered peer educators to plan for the sites and populations that they are responsible for. In Zimbabwe, the HIV prevalence in men who have sex with men (MSM) is 17.1%, while it stands at 60% for female sex workers (FSW). Admittedly, key populations have a higher HIV burden than the general population. To address this, the national program in the country trains key population peer educators to use the microplanning tools to plan for services, assess gaps in programs, and engage in collaborative solution creation with key populations. Malawi has also taken up microplanning specifically for sex workers and men who have sex with men. Using microplanning, the community outreach team extends support to key populations who have high risk and vulnerability. Microplanning helps the outreach team to understand the needs and preferences of the key population and avail services in a confidential way while focusing on those who are generally left behind. Although a number of countries have adopted microplanning, there still exists a large gap in its implementation across the continent. Part of this comes down to a limited understanding of the microplanning tools and limited peer-to-peer learning. This series is intended to bring that knowledge home so that the community-trusted platform in a key population program is effectively used to reach all subpopulations and provide services according to their needs and preferences.